10th day today after the operation. Swelling is still there, a little bit in the foot. Actually, I think the knee has got worse, so it's that old adage, sometimes things need to get worse before they get better. And all you need to do is be patient. Today, we're going to do 2 things which will help with the swelling and also help with managing stairs outside. Here goes. So we're going to be quite close to the wall. You can also have your heels touching the wall. For some of you that might create instability, so obviously just use common sense here. Now the only thing we're going to do is, with the abdomen coming towards the wall, we're going to slide our bottom essentially up the wall, maybe bringing our shoulders back a little bit in the direction of the wall, not touching, but certainly in the direction of the wall, so you keep a nice open chest. And you want to get onto your tippy toes. So there's no worry about falling because you're resting with your buttocks against the wall. And you can just stay there for a few moments, breathing just normally, and then you can come down. And that is it. So it's really, really nice for the underside of your foot, so it's stretching in a glorious kind of way, but also you feel this nice stretching the whole way up your leg. Do not collapse your torso down towards the legs. Remember, it's this kind of 2 directions, so the bottom of your belly moves in one direction and the other part of your torso just moves towards the heavens. So you can do that a number of times, just up and down, and just luxuriate in that stretch. Now, the other thing that we're going to do today is more pragmatic. I'm trying to manage the stairs. I have fortunately no stairs in the house, so I'm managing stairs outside, and I'm a bit scared, to be quite honest, so I've still got my crutches for the stairs. So I wanted to do some exercises which are going to give me some confidence, and to that end I'm going to use some bricks. If you don't have yoga bricks or yoga blocks, you can just get some books or something, yeah? Just make sure that they're solid and they're not going to move under you. So I'm going to start off with something really, really low. You know, this would be a couple of, maybe 4, 5 Asterix and Obelix books, that type of width. Just going to put it down. And I might have 2 just to accommodate both my feet. So I'm going to stand up. And I'm going to lift my hurt leg and just put it on the brick so the whole foot is down. And then belly in, chest moving forward as per normal. I'm just going to go up on to the toes of my back leg, and you can see that this resultingly has stretched my front leg. And then I'm just going to come down. Repeat. So that's kind of moving towards the action that we need for stairs, yeah? Eventually, you can just simply bring the other leg or other foot onto the brick. And then you can do the opposite. So keeping the belly in, bring the toes down so you see the heel is nice and high of the back leg. And eventually, by bending the front leg, I can start to bring the back leg down. Now, it's actually really good to do both legs because in this period, both our legs are not moving as much as they should, and they both really need a nice stretch. So do the same for the other side, even though maybe it's needed a little less. So starting with the bent leg of the foot that's on the brick, just come up onto the toes of our back leg, and this straightens the front leg, and then we can just move on. And you can see how much easier it is for me because the leg that's got the weight as I move onto the step isn't hurt. And I do the opposite. So bring the foot back, put the toes down, start to bend my front leg and bring the back legs down. Now you can do that a number of times and you can start to make things more challenging. So I'm going to use bricks so you can see it's just slightly higher in terms of me stepping up and down. Let's have a go. So going back to using my hurt leg on the brick, and I can raise the back heel to straighten the front leg and just do Up and down a couple of times. And then I can get brave and come up. And then go back, bringing the toes down. Keep really, really focus on the belly because that's where the strength is. So if there's any kind of wobbliness, you can think here, and obviously feel free to put your fingertips on the wall, that's not a problem. I'm really close to the wall, so there's no danger of me falling. And then I can do the other side. So bent leg in the front leg, straight leg on the back leg, and then I start to come up, straightening my front leg, bring it up, and then do the opposite, bringing that hurt leg back down to the ground. And obviously, as and when the strength develops, you want to get away from the wall. And then you can start building height. I'm not sure whether I can manage it, but let's have a go. Use the blue brick underneath the cork brick. I'll do my non-hurt leg first. So you can see there's a lot more. I've got to go right onto the point of my foot, then come up. So that's worked okay. Next start to come down. But I'm not sure I'll be able to do the other side. Let's see. So this is my hurt leg. So I need to push down with my front leg, get onto the tips of my toes. You can still see that I'm balanced with both feet on the ground, and then I can come up. So a bit more of a stretch, slightly more uncomfortable. Let's see if I can come back. I'm a bit scared here. I might just put my fingertips on the wall, bring my toes down to the ground, start to bend my hurt leg, and come down. That's it for today.